Any more people? That's good. We have 13 people so far. Hey, Pramida. Okay, we'll start in 1 minute. All right. So now it's a good time to start. We have 15 people here. Okay. Hello, everyone. Welcome to the Dentistry Admission Process presentation by Pre-Dental Association. My name is Kirash, and today we are lucky enough to have Dr. Rojin Kiani as a speaker. She will be sharing her knowledge about the admission process with us. Before we start, just a quick note for volunteers. The volunteer form will be shared at the end of the presentation, so please stick with us until the end of the presentation. And if anyone has any question throughout the event, just drop them in the chat, and Dr. Rojin and Kiani or me will look at them and answer. So let's get started. Dr. Kiani, if you could please tell us a little bit about yourself, and then feel free to take it away.
Sure, sounds good. Hi, everyone. My name is Rojin, and I'm really happy to be here. I've been giving some talks at UBC, Pre-Dental Society, and Western, and it's been great so far, just meeting with pre-dental students. I was in your shoes not too long ago. So what I'm planning to do is I'm planning to give you guys a little introduction about myself, talk about my undergrad story, give you some sort of tips on how to study for the DAT, references, research, volunteering, shadowing, and things like that. But I'm really hoping this will be more like a conversational discussion. I haven't prepared slides. I'm just gonna sort of freestyle it. And if you guys have any questions, either pop them in the chat or ask them at the end, unmute yourself and ask them at the end. So I'm joining you guys from Vancouver, BC. About myself, I'm originally from Vancouver, actually. I've had a boring life. I've pretty much been in Vancouver my whole life, and I've done my undergrad, dentistry, everything here. My story is kind of interesting in that I never had dentistry in mind up until the end of first year university. In my family, everybody was either a practicing medical doctor or cousins were doing their medical residencies and graduating and things like that. So I always thought I was going to follow in my family's footsteps and become a medical doctor myself. Starting grade 10, I was kind of gunning for med school. I was volunteering at Canadian Blood Services, Canadian Cancer Society, and things like that. And it wasn't until it was first year undergrad at UBC when I started volunteering at a hospital here, St. Paul's Hospital, when I realized that, medicine is really not for me for two reasons. One, I wasn't emotionally strong enough to see really sick people all the time. And, I would tend to internalize their pain, and it was too much for me. And then secondly, I'm a really restless person. I need to be doing something with my hands all the time, or else I'm just not having a good time. So, it was the end of first year when I realized that medicine's really not for me. And I didn't really have anything else in mind. I had no idea what I was going to do. It was the end of first year. It would have been 2012 back then. And one day I was just having breakfast with my dad, and he asked me how school is going, and I told him it's not going well because I don't know what I'm going to do with my life. And he said, "Have you considered dentistry?" because it's healthcare related, and you still get to do procedures and things with your hands that you like. And it was at that time when I started seriously pursuing dentistry, and that was at the end of first year undergrad at UBC. I did my undergrad in kinesiology and health sciences at UBC because of my background in sports in high school and things like that. Kinesiology was the path I chose, and I found it pretty interesting. And basically, at that point, end of first year, what I started to do when I started to want to do dentistry, I basically went on the UBC Dentistry website. There's a list of emails of all the faculty members, and I emailed every single one of them. There were 52 at the time, asking if I could shadow them and or become a volunteer research assistant, basically. A lot of them ignored me, never got back to me. Some of them, had the decency to get back to me and reject me. And there was one professor at the time, she was a prosthodontist. Prosthodontists are specialists who basically do implants and dentures and crowns and bridges, basically restoring dentition. That's what they do. She got back to me. She was working at the cancer agency here. And she took me on as a volunteer research assistant. And basically, she would work one day a week at the cancer agency, and I would get to shadow her that day and do research with her. And I found dentistry so interesting just from the procedural aspect of things, and also just the research I was doing with oral cancer screening under her supervision, that I actually ended up staying on as a research assistant for 7 years. So all throughout undergrad, and also for the first 3 years of dental school here at UBC. So research was definitely something that I really enjoyed doing, not just to get exposure to the dental field, but also to find out more and hone my skills in research. Now, that's my undergrad story. In terms of the GPA and things like that, I was talking to Karash. I understand that a lot of you guys are from Ontario. You're applying to all the Ontario schools and UBC. The GPA was competitive at the time. I was applying in 2015. And what I would say is, for the GPA, you kind of have to see if there's anything you can do to improve your GPA if it's not high enough. Like, if there's GPA booster courses you can take here and there, if there's summer courses you can take, additional summer courses to raise your average a little bit. Or there was one girl in my UBC dentistry class who actually did a second degree. So that's something you could do. I didn't have a high average. My first year grades weren't high. So what I had to do was, UBC dentistry had this option where if you went over 4 years, you could have your lowest average year dropped. So I had to take advantage of that option, which meant I had a gap year. So I did 4 years of undergrad. I graduated in 2015 from kinesiology at UBC, and then I had a gap year. And I had to have that gap year in order to have my lowest average year, which was first year, dropped. So that's what I had to do to basically raise my average, because including my first year, it wasn't so great. And I heard that UBC dentistry still has that option available. So that's something that, a lot of people could take advantage of, because first year average usually tends to be the lowest for most people, because you're coming from high school to university. So in terms of the DAT, I basically, I would say don't worry about how many times it takes for you to get a good DAT score. There's no shame in the number of times you take the DAT. I took the DAT 3 times. The first time I took it, at the time, the DAT was only offered in November and February of each year, so only twice a year. And UBC dentistry at the time didn't even accept the American DAT, so it had to be the Canadian. So for me, the first time I took it was in November of third year, just kind of as a practice run. My score wasn't good, and then I took it a second time in November of fourth year. And fourth year was busy. That term I was doing a lot of difficult courses like biochemistry, pharmacology, and things like that. So my score wasn't high again. And it wasn't until my third try, which was the February in fourth year, that I got the score that I needed to be competitive. So I would say don't worry about how many times it takes. There's no shame in how many times it takes for you to do well on the DAT. It really doesn't matter. Once you get in, it doesn't matter what your score was, how many times you took it. There was a girl in my class who took the DAT 6 times and she still got in. Like, that's all that matters at the end of the day. In terms of how to study for the DAT, for me, what I found that worked for me really well was doing as many practice questions as possible, especially with the PAT, because the PAT is so different from anything you've done in your undergrad courses that I just wanted to do as many questions as possible. I think I downloaded this software. I can't remember if it was called DAT Crusher or DAT Destroyer. I can't remember what it was called, but it was a really helpful software that I had downloaded on my laptop. Nowadays, everything is online, I guess, but I just had access to a lot of different questions, hundreds of questions in each category, whether it was PAT or verbal reasoning or things like that. So for me, just doing as many practice questions as possible really helped. I would recommend starting to study for your DAT when you're in third year, kind of getting into it, maybe doing a practice run. Don't be too hard on yourself the first time you take it. It's pretty different. Some people, I know some people who did amazing their first try, and I wasn't one of those people. I kind of needed to become familiar with the process, and there's no shame in that. So, I would recommend kind of starting to look into it / taking it more seriously in third year. If you're planning to apply in fourth year and, things like that. Now, in terms of research, when I was giving a talk at UBC and Western, a lot of people asked when would be a good time to get into research. I don't really know how to answer that. It's something that if you enjoy doing research, then obviously getting into it as soon as possible would be the best thing to do. But if you don't enjoy doing research particularly, it wouldn't really make sense to get into research and not necessarily do well, because you may not get a good reference letter. So just gauge your interests. Research isn't necessarily a requirement to get into dental school in Canada or the States. It's just a matter of if you're interested in it or not. If you're interested, then obviously you want to pursue it as early as possible. If not, then it might be worth your while to look into other things. Shadowing was a topic that really came up. I encourage each and every one of you to shadow. Shadowing, I know it's hard nowadays just because with COVID restrictions, they want to restrict the number of people in dental clinics and operatories, and patients are overly cautious, but it's not a bad idea to see how many clinics there are in the neighborhood you're living in, and then maybe trying to email every single one of them, visiting them in person, and asking if you can shadow the dentist for a couple hours a week, or maybe once or twice. When you're shadowing, don't be too focused on the number of hours I need to get this dentist like signature or whatever. Just really try to see what the field entails, because this is something you're going to do for the rest of your life. So, you want to make sure that you actually enjoy doing it. And, when you're shadowing, really try to be in the moment and see if it's something that you want to do for the rest of your life, and worry less about, signatures and things like that. In terms of shadowing, the other thing that here in Vancouver, in British Columbia, we have a shortage of certified dental assistants. It's a program, you go through the program, I think it's almost like 10 months, and you become a certified dental assistant, but that's not necessary because there's a huge shortage going on in BC. A lot of practices are struggling finding certified dental assistants. So what they do is they just take on dental assistants and train them. So last year I was working at a busy practice here, and we didn't have any certified dental assistants. There was a pre-dental student who reached out to our office, and she was wondering if she could get exposure. And we asked her if she actually wanted us to train her to become a dental assistant. And I think it took us 3 weeks to train her how to take x-rays, how to suction, how to pass instruments, how to place a rubber dam. And it only took us 3 weeks to train her. She was a pre-dental student and she had a gap year coming up. So, we ended up hiring her and she's still practicing as a dental assistant. So to me, I think, that's a great way to get your shadowing hours, to learn and get your foot in the door, and also to get an amazing reference letter that I'm sure every school in Canada and the States would be more than pleased to have an applicant who is a dental assistant in their gap year or during, part-time in the summer or during undergrad or things like that. So I would say that shadowing is probably looked upon more favorably than research. I don't know of any dental schools that specifically look for research in applicants. I think that, shadowing is definitely, I know for UBC, they say it's recommended, but I'm pretty sure that if you don't have any shadowing, it doesn't look too good. Um, and again, because of the COVID restrictions and things like that, I was saying, it might be worth your while to try to become a dental assistant, trained by the office, to get the shadowing experience that way. Um, in terms of interviews, interviews are really important. I know that in a lot of schools, including UBC Dentistry, once you get to the interview stage, everybody's kind of on equal grounds, where your interview score is what sets you apart from other people. For the interview, I had a gap year, and during my gap year, I was pretty confident I had a chance at getting an interview at UBC Dentistry at least, because I was in province. So, and even if I wasn't going to, I just, I wanted to put all my eggs in one basket, and I wanted to practice as hard as I could for the interview. A lot of people underestimate the importance of the interview. A lot of people just say, oh, I'm good at talking to people, I'm extroverted, then I'll be okay. The interview process, I don't think it has anything to do with being extroverted or being personable or things like that. It sure helps, but it's not the only thing that matters. I know a lot of extroverted people who don't necessarily do well in the interview, and I know a lot of introverted people who do really well in the interview. I think what sets people apart from each other is practice, 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 practice. I would say that I would recommend practicing for the interview, especially if it's the MMI where it's so strange. We've never been through the process. I would highly recommend you guys practice for 4 to 6 months. For me, during my gap year, I was, let's say in my head, I was like, I might get an interview at UBC Dentistry. I'm just going to assume that I'm going to. It's better to be safe than sorry. And I knew the interviews were going to be in January. This is back in 2015. So I basically started practicing for the interview in October, and I practiced all the way up to the end of January, which was the interview taking place. A lot of schools are doing MMI now, where you have 2 minutes to think and then 8 minutes to talk. I know that for med school, based on what I've heard, a lot of their interviews tend to be more conversational, more dialogue based, where you talk for a couple of minutes and then the interviewer will ask you prompt questions to get you talking more. At least I know for UBC Dentistry, that's not how it is, unfortunately. The interviewers are not supposed to interact with the interviewees. So you basically have 8 minutes to talk. That doesn't necessarily mean you have to talk for the whole time. If anything, I would say, it's much better to have a high quality response and only talk for maybe 4 or 5 minutes and sit quietly than to be talking for 8 minutes and just ramble on and repeat yourself. And, it's not fun for the interviewer. When I first started practicing for the MMI, I didn't have much to say. It was kind of weird to, just only have 2 minutes to think and come up with ideas and then 8 minutes to talk. So for me, what really helped me was basically two things. One was obviously practice, practice, practice. I was lucky in that I had my partner at the time was going through medical school interviews, so we would be practicing all the time together. And they also had practice sessions on weekends at UBC, and we would go every single weekend. And there'd be stations set up, and you'd go from one station to the other station, from the other station. And at first you're not gonna be good. It's a weird process to get into. It's a weird sort of training for your brain to get into the habit of just thinking for 2 minutes, talking for 8 minutes, but it'll get better. You'll get better. So one was practice, practice, practice. I know that in other schools like York or Toronto or Ontario schools too, they hold practice sessions close to interview times for medicine and dentistry. So, I would just go to those, even if you don't necessarily have an interview coming up, it doesn't hurt to get yourself in the habit of thinking in that way, in the MMI way. And it sure helps for personal interviews too, because personal interviews are pretty much the same thing. So practice was number one. And then the second thing was trying to read the news and staying up to date with current news. I downloaded the New Yorker app on my phone. I downloaded the New York Times app on my phone. And, every time I was on the bus or I had any downtime, I would just pull up an article and just read it. It would help to come up with ideas and also be in the know of what's going on in the world. A lot of schools, they love asking about current events to see if you're, living outside the box and, you're not just somebody who's studying and, doing research all the time, but you're actually living in the world. I had my interviews in 2015, as I said, and at the time, the Syrian refugee crisis was going on. So 3 of my stations at UBC dentistry had to do with asking my opinion, how I felt about it, and things like that. So, it's really important to know what's going on and not to necessarily be opinionated, but, show that you have critical thinking ability. I would just, highly recommend that you practice as much as possible and, just read articles and be up to date with current events. What else can I tell you guys about? I don't know if you guys are interested to know about actual dental school, because everybody here is a pre-dental student, but I was the incoming class of 2016 at UBC Dentistry, and I graduated in 2020. At the height of the pandemic, the last 6 weeks of our clinic was transitioned online, and I didn't even have graduation, which was unfortunate, but I know I don't get to complain too much because you guys have all been living it for the past 2 years too. But I've been practicing for the past 2 years, and I can assure you guys that all your efforts and all the pain and suffering of being a pre-dental student and going through the application process and being stressed out all the time, it's going to pay off, because once you make it to the other side, it's a really rewarding career path. You have a lot of autonomy in the number of days, hours you get to work. And, the field is so broad. There's so many different things in dentistry. If you choose to want to do surgery, then you can just kind of specialize your practice into that. If you want to do more cosmetics, which is what I'm passionate about, then you can sort of just do that. So it's a really interesting broad field. I think I've been talking for 20-ish minutes, and I can take up some of your guys' questions. It says, so the first question from Nimra is asking me, what did you do during this gap year and after? So I had a gap year. It was basically my 5th year. I graduated at the end of 4th year, and then I had that gap year. So I wasn't taking any courses. And I was basically just tutoring. I was tutoring students, high school students, pretty much part-time, because during the day they're in school. And so I was tutoring part-time, and I was honestly just practicing for the MMI. I was doing a lot of practice MMI questions. I was reading a lot of books, because reading definitely helps to come up with ideas. And that's basically what I was doing with my time. Tutoring, practicing for the interview, reading, and that pretty much took up a lot of my time, because the application and working on the application process. I was telling Kirash before you guys joined, I applied to UBC, University of Toronto, and Western. Those are the only three schools that I met the requirements, because the other schools like Alberta, Saskatchewan, Manitoba, they required physics courses, which I didn't have. So it didn't really make sense to apply. Those are the only three schools I applied to in my fifth year. I got rejected from University of Toronto, didn't even get an interview, and I got an interview from UBC and Western. Um, UBC interviews, I know they're even earlier now, but at the time they were still pretty early on. It was the end of January, and I got in at the end of March. Western, I got an interview, and it was interesting because I don't know if Western is still doing this, but I didn't have a physiology course requirement, but it's okay where if you don't have the physiology requirement, you still get the interview, and then I think up until your interview, or you have a certain time frame where you have to do this, challenge this physiology exam, which I did. I challenged it successfully, and I actually got into both UBC and Western. And I chose UBC because that's where my family was, that's where my partner was, and I wanted to stay local. Um, yeah, so that's the answer to the first question. And the second one, can you talk about volunteering? How much volunteering did you do? For me, when I was in, so grade 10, grade 11, grade 12, and then first year university, I thought I was going for medicine. So I was doing quite a bit of volunteering with medicine in mind. I was, as I already mentioned, I was volunteering at Canadian Blood Services just as a volunteer, providing refreshments to the blood donors, Canadian Cancer Society, and I can't remember, Big Sisters, Big Brothers, where you're a mentor to somebody of a younger age from a lower socioeconomic status. And, I would meet with little girl once a week, and then I would tutor her. I would talk to her about school things and stuff like that. But at the time, at the end of first year university, when I decided I wanted to do dentistry, at the time, I don't know if this has changed necessarily, but it seemed like Canadian dental schools, at least, they favored a high GPA and a high DAT score more than volunteering. So for me, I kind of decided I was taking 5 courses a term, and I really wanted to do well on my courses to raise my average so I could get in. So I kind of stopped at the end of first year volunteering. I kind of stopped volunteering, and then I was just focused on my average and the research project that I told you guys I was doing all throughout undergrad. So for me, volunteering for me consisted of being a research assistant and also getting shadowing. Other than that, I didn't really do much volunteering. I know that some American schools are more big on volunteering. So the recommendation I would make is try to find something that you like, that you're passionate about, and try to stay in it long term, because I know that medicine, for example, they are really big on volunteering and volunteer hours and things like that. And they definitely love seeing somebody as a long-term volunteer in a company or organization, as opposed to having a lot of like short-term special event volunteer type. So find something you're passionate about, whether it's cancer or blood donation, or there's so many different organizations nowadays. Find something you're passionate about, and then just have some sort of a leadership role, or work towards getting a leadership role within that organization, and then stay with them long term. And that way you can get a good reference letter too. Is there concerns of the field becoming oversaturated as of recent? That's a really good question. So I think it really depends where you're practicing. I'm originally from Vancouver, and then I stayed in Vancouver after graduating too. And unfortunately, Vancouver City as a city is very saturated with dentists. And to get a good job, so it's easy to get a job as a dentist, but it's hard to get a good job, at least in Vancouver. It's hard to be busy or find a clinic which is productive and busy all the time. So a lot of my classmates, they actually ended up moving up to rural areas like in northern BC, A lot of them ended up moving to Alberta where the fee guide is higher. So dentists get paid more, and a lot more people, because of the oil industry, a lot more people have insurance. So there's more patients. So, and for me, I decided to stay in Vancouver, but I wanted to be busier right after graduation to get my clinical skills up and pay off those huge student loans. So, the suburbs are a good place. If you're willing to, I would say, if you're willing to move to a rural area, or if you're willing to drive for a long time to go to the outskirts of the city, then you don't have to be as worried about saturation. For me, for my first year after graduation, I was working in a suburb called Port Moody. I don't know if any of you guys are from Vancouver area. So it would take me 2 hours in total in a day. So hour and 10 minutes each way. It was really, really tough. I did it for a year just because it was a really busy, really productive practice. So to me, it was worth it because I wanted to learn as much as I could right after graduation. But the 1 year was all I could do. It was a bit too far for me. And then now I'm working at a more central practice, but I'm less busy. I've heard that the Greater Toronto Area is also very saturated with dentists. But that said, there's a lot of small little suburbs and towns like, you guys have Oakville, and um, I don't know my Toronto geography really well. You guys know it better. So I would say if you're willing to move to a rural area, maybe even for 1 or 2 years, just to get your skills up and to get paid more so you can pay off those loans, and then come back once you're a better, faster, more efficient dentist, that's what I would do. That's one thing I would recommend. The other thing is, if you're willing to drive a farther distance to get to work in the suburbs or outskirts of the city, that's another option. I wouldn't worry about the possibility of not getting a job because that almost never happens. Like I said, even if you wanted to stay in the city, you're like, I want to play, or I want to practice in downtown Toronto. Even if you wanted to stay in the city, I'm sure you could. It's easy to find a job as an associate dentist. It's hard to find a good job. So if you really wanted to stay in the city, it would just mean that you would have to lower your expectations a little bit. So, that would mean not having as many patients as you would hope for, or not being able to do the procedures you would hope for. So it's all about adjusting your expectations a little bit. How did you know you're interested in cosmetics, not surgeries? That's something that you really find out during dental school. It's not something you would know before dental school. A lot of people before dental school, it's not, even when you're shadowing, even if you've been shadowing for a number of years before getting into dental school, you don't really know what the field entails until you're in it. For me, I really, during dental school, you don't really get as much exposure to clinical stuff. You don't get, because you still have lecture, and then you have a little bit of clinical. Obviously, you have a lot more clinical in third and fourth year, but every day, even in third and fourth year, you're seeing maybe 2-3 patients a day, which is not that many, because the appointments, they're longer, they're 2 to 3 hours long. So, there's a lot of checklists. You have to get everything signed by an instructor and things like that. So seeing 2 to 3 patients a day is really not that much. It's really the first year after practice that you get to be thrown into the deep end. And, the busy practice I was at, I was seeing maybe like on a really busy day, on a Saturday where I was by myself running the practice, I would see 20 to 30 patients a day. And on a quieter day, weekday, where there would be 2 other dentists, I'd be seeing like at least like 10-15 patients a day. So it's the first year after practice when you really realize what you enjoy doing, what you don't enjoy doing. For me, I really enjoy doing fillings, so restorations, and prosthodontics, which is doing crowns and bridges. And then at the end of first year, I kind of started to get more into cosmetics too. So doing veneers, doing composite restorations in the front teeth, doing Invisalign, doing Botox. And the reason why I got into it, I think, was because the first practice I worked at, the owner at the practice, she was a cosmetic dentist, and she really influenced me. Her work was really amazing, and I got to see how she could transform smiles from not so good to amazing, before an upcoming event such as a wedding, or, I really got to see how appreciative patients are, and how much better care of themselves they will start to take once, their dentition have been restored, basically. So on the other hand, I didn't really enjoy doing surgery like extractions, pulling out teeth. There's something to do with blood. I just don't like seeing blood. It's really hard to see what's going on, and it's not as pleasant, pulling out teeth, and not really, leaving it empty. That's not something that I was personally interested in. I'd rather restore and, add on to teeth and make them look nicer and more perfect and prettier than just take them out and things like that. But again, as I mentioned, the beauty of dentistry as a field is that it's so broad that you can do so many different things. If you're interested in surgery, then you can just go into, even as a general dentist, you don't have to specialize. You can just go into doing implants and complicated wisdom teeth extractions and gum surgeries and things like that. And if that's not what you're interested in, like me, there's always another dentist at the practice who you can refer those cases to. Or if they're even more complicated, then as a general dentist, you have the luxury of referring those cases out to specialists. So, yeah. So the next question, hi, Dr. Kiani, did you apply to universities other than UBC? So I think I touched on this one maybe after you put this question in there, but yeah, sorry, you already answered. Yeah. So basically my plan was during my gap year, I wanted to apply to the Canadian schools that I met the requirements. So I applied to UBC, Western Toronto. And then my plan was, if I didn't get into any of those schools in my fifth year, then in my sixth year, my plan was to again apply to those Canadian schools and apply to US schools. There are a lot of great schools in the States, like Case Western University, University of Detroit Mercy, Michigan is a really good school, University of Minnesota, UPenn, University of Maryland, I think. There are a lot of good dental schools in the States, and that was definitely my plan. If I could go back in time, maybe I would apply to all of those US schools and Canadian schools in my fifth year. Just because, why not? You want to open as many opportunities for yourself as possible. Just before you guys hopped on, I was talking to Kirash about Australian dental schools. I can only speak from my own experience based on what I've seen. I know I had a number of friends who ended up going to Australia to do dental school at the same time I was doing my dental degree here at UBC. And I've also practiced with Australian dentists who came back here to practice. And I've heard two things. One, in Australian dental schools, they don't really focus on the knowledge base in medicine and dentistry. So here, Canadian and US dental schools, the first 2 years, they still cover a lot of medicine, which is actually required to pass your boards. You all have to take the Canadian boards at the end of fourth year in order to be able to license in the country to practice. So the Australian dental schools, they barely do any theory. They barely do any lectures and knowledge. So for example, they don't cover occlusion, which is the bite. They don't really cover any medicine, any pharmacology, which you actually have to know as a dentist in order to prescribe. So a lot of Australian graduates actually struggle with passing the boards when they come back here. And the other thing is, in Australia, they get a lot more clinical experience, but that said, the instructor to student ratio, from what I've heard, is quite a bit higher. So your work isn't necessarily being overseen or monitored by any instructor. So, to me, it doesn't matter if you're doing 50 root canals, if they're all going to be bad. I'd rather do a couple of root canals and have it seen and, receive constructive feedback from an instructor who's looking at it in order to get good at it. So, this is my personal suggestion. You guys don't have to take it. I would recommend that you try to stay within North America. So Canadian and US dental schools, there are a lot of great dental schools in the States. I've personally worked with and known people who graduated from New York or UPenn or Michigan, and they're all amazing dentists. And, I would personally if I would go back in time, I would try to stay in North America for sure. Do you have any colleagues that had to reapply more than once? Any insight on reapplications? I myself, I applied in my fourth year. In my fourth year of undergrad, I applied to UBC dentistry only. And I knew that my chances of even getting an interview were very slim because I already told you guys my first year grades were quite low. And I knew that in order to get an interview, I had to have my lowest average year dropped, which was my fifth year. And sorry, which was my first year. And to do that, you have to go over 4 years. So I didn't get in fourth year. It was in my fifth year that I got in. Do I know anybody who didn't get in? I'm sure there's lots of people. I would say don't get disappointed if you get rejected the first time or the second time or even the third time, because once you get in, it doesn't even matter what your GPA was. It doesn't matter how many times you took the DAT. It doesn't matter how many times you got rejected. It really doesn't matter. You know, what matters is working hard, being persistent, and not getting disappointed in yourself and only comparing yourself to yourself yesterday. Every day, every year that you're working harder, you're getting a step closer to getting into the school of your dreams. So, you know, I know it's hard if you're for me, for example, I was telling Karash when I was in fourth year kinesiology, a lot of my good friends in kinesiology, they were applying to medical schools across the country. And every single one of my friends got into med school, and I was the only person who didn't get into dentistry, and I had to have a gap year. So it was disappointing, it was frustrating, it was definitely a hump to get over. But I would say try to stay positive, compare yourself to yourself only. I know it's harder said than done, but you know, it's important to keep a positive attitude. And, you know, if you keep working hard at it, you will eventually get in, I'm sure. Hi, Dr. Kiani. I missed the beginning of the meeting. Did you mention what competitive average GPA UBC is looking for? I heard that UBC is no longer posting their competitive average scores anymore. They used to post the average, and it was nerve-wracking because it would always be high, and I'd keep checking it all the time, and I'd compare myself, and I get you know, they're not posting it anymore. So I'm not really sure what the competitive average in DAT is. Do you know if it's common for UBC dental hygiene graduates to apply for the dental program and typically get in, provided all prerequisites, including the DAT, have been satisfied? So I know that UBC dentistry, and from what I understand, all Canadian dental schools, like all they care about is that you've taken the prerequisite courses. They look at your overall average, and I'm not sure if they look at your prerequisite average separately, but basically, you know, it doesn't really matter if you do dental hygiene or if you do any other degree, undergraduate degree, as long as you've taken the prerequisite courses, you have competitive grades, and you've taken the DAT and you have a competitive DAT score. So I don't think that being in dental hygiene necessarily puts you at an advantage or a disadvantage compared to other students. In my program, there was actually a girl who was a dental assistant for 8 years. Then she was a hygienist for 4 years. And then she went back to school and part-time, and she took all the prerequisite courses, and she got into UBC dentistry. So, you know, from what I've seen, if you work hard and if you're persistent, you're going to get into dental school one way or the other. And it really doesn't matter whether you go to a Canadian dental school or the US dental school, as long as you pass the boards and you come back here to practice. What did your colleagues from Australia have to do to pass the board exam? I guess I would just say that they just had to study harder. They just had to study harder, and they just had to um, start studying for it more seriously and give themselves more time. The good thing about Australian dental schools is there's a lot of Canadian students who end up going to Australia, and they obviously want to come back here to practice. So my classmates, my undergrad classmates who ended up going to Australia, they all had a really close-knit community of dental students who want to come back to Canada to practice. So they had board study sessions, and they would provide each other with study materials for the boards and things like that. It's just that for like the Canadian dental students would obviously be more or better prepared for the boards. So we didn't have to start studying as hard. Like we would only start like 2 months before the boards. We would start studying for it seriously, but they would basically start a year in advance. So, I'm not saying you're not going to pass the boards if you go to an Australian dental school. It just means you have to start studying, earlier. Have you worked with dentists from Ireland? If so, any insight on their knowledge base? I have not. I don't know of any dentists from Ireland or any other European dental schools for that matter. I'm not really sure how it works. So I'm sorry, but I don't want to speculate, and I don't want to tell you something that I have no knowledge about European dental schools. I don't really know anybody who did that. What courses in undergrad would help with DAT? Ooh, that's interesting. I don't think any courses would help for the DAT. I think the DAT, from what I remember, the biology and chemistry were pretty straightforward. You had to study for the biology and chemistry of the DAT specifically. So studying, I think I studied all the Princeton books. Kaplan books were quite a bit easier, so they didn't help me as much. Maybe they've changed them now, but I studied the DAT Destroyer, the DAT Crusher, any book with practice questions that was there, I would basically do it. And for the PAT, it's just practice, practice, practice. There's no undergrad courses that prepare you for that. And for the verbal reasoning, I would say reading articles, as many articles as you can. Reading really helps, not just for the interview, but also for verbal reasoning, because, you have a certain amount of time to read this passage, and they ask really specific detail-oriented questions in the passage. So, I would just recommend that you study for the DAT specifically. The undergrad courses, they're not really geared towards preparing you for the DAT or the MCAT or anything like that. It's just one of those admission tests that you have to study for separately. What is the lowest GPA you see someone get into dental school among your friends and colleagues? So I was the incoming class of 2016. I graduated in 2020. So I'm a bit, behind in terms of the trends right now, but I would say probably the girl that I told you about, like who was a dental assistant and hygienist, and she probably had, I think it was like 82% or something like that. But that said, this is the 2016 incoming class. I don't know if it's applicable to this year or things like that. But I think that if if your average is in mid 80s, and you can always take and retake the DAT as many times as you want. And in my class, there were definitely people who did, like, I only had a 21 score in my DAT. But there were people who had 25s and 26s, and that was crazy. So from my understanding, if you have a higher DAT score, then that can sort of make up for maybe a lower average. And so it's not, I don't think it's just the average or it's just the DAT. You can make up for the other one. Like for me, my average was higher. My DAT was 21, which was really average at the time. But, I think if your average is in mid 80s and you try to get really high in the DAT, then that should make up for a lower average. Could you share some of your best study lecture tips with courses? Study lecture tips. For me, writing down notes really helped. I found when I was in undergrad, if I typed my notes, it wouldn't really stick as well. So writing down the notes, just the act of writing, would make it a lot more memorable for me, if you will. It would just be easier for me to retrieve that information. Um, just having study groups with friends, not too many people, maybe one or two other friends, so you don't get too distracted from working with each other, but having one or two study partners and having study sessions, weekly study sessions, and bouncing questions off of each other and sort of, quizzing each other, that's really helpful. It was definitely something that stuck with me throughout dental school too, because there's so many courses in dental school and there's so little time. So, studying with other people was what really helped me get through exam season. What do you think of going to Australia right after high school and skipping the undergrad? Uh, I don't recommend it because it's 5 years after high school. It's 5 years after high school, and it's just, I don't know what it is. I don't know if it's just, it's not something that I did, and I don't know anybody personally who did it. So I personally wouldn't recommend it. I think it's better to do your undergrad and, open up more opportunities for potentially Canadian and US dental schools. Again, you guys know, like from what I told you, I'm biased against Australian dental schools. I would always encourage people to stay within North America. So for me, I would, if you could do your undergrad and, get more, open up more doors for Canadian dental schools or American dental schools, then that's a better idea to me, at least. What was your GPA in undergrad? It was high 80s. So it wasn't 90s or anything like that. It was high 80s. It wasn't anything that was extraordinary. But at the time, if you had a high 80s average, that was good enough as an in province at least. There were definitely people in my class who had like 90s averages, and I wasn't one of them, but if you get in, you get in. It doesn't really matter if your average was. So, yeah. Did you take any courses? Like, what do you mean, Alejandra? Oh, retake any courses. Like, did I retake any courses? Like, did I fail in courses and have to retake them? Yes, I didn't. No, no, I didn't retake any courses. Um, hmm. But I would imagine that if somebody had to retake a course, I would imagine that, if it's, I know a lot of schools, they drop the lowest average year. I know Western did it, UBC did it. So it's definitely something that you can, if you had a really bad grade, uh, why didn't you get accepted to U of T? Um, I don't think my GPA was competitive enough. I think that I had classmates who got into U of T and their averages were in 90s, and um, their DAT scores were 23 and above. I didn't have that. It's just, I think U of T, at the time at least, it was the most competitive dental school in Canada. So it required higher averages, higher DAT scores, and I just didn't have it. And I didn't even get the interview there. Do you recommend retaking courses to get a higher GPA for certain courses? I'm not sure if I would necessarily recommend retaking a course. If you failed a course, then obviously you have to retake the course if it's a prerequisite course. But say if you got 60 something in a course, retaking it, if it was me, I would rather just take some GPA booster courses to boost the overall average as opposed to retaking the same course. I think people prefer Australia or Ireland over US because US is significantly more expensive, especially given the exchange rate. Um, I don't know if Australia is less expensive than the US. And when I'm speaking in terms of which, whether to go to the States or to go to Australia, I'm just speaking from the dental degree sort of aspect of things and the clinical aspect of things. I'm not really speaking in terms of the cost. I'm not sure which one is more expensive, but from what I've heard, Australian dental schools are quite expensive too. Um, as long as you get into dental schools in Canada, your statistics are considered competitive. Do you recommend going from master's or post baccalaureate to improve the GPA? And that's a good question. I do. I think that definitely if you, if your average is not so good and despite dropping your lowest average year, there was somebody in my class who did a second degree to boost their average. So that's definitely something you could do. Or doing a master's. PhD is obviously a longer commitment, but doing a master's in science or something like that, as long as it's a course-based master's degree, so you still have a chance to boost your average, then yeah, it's something that definitely I would definitely recommend. In my class, there wasn't anybody who did their master's, but it was a smaller class of 50 people from UBC. I don't know about other schools. I would imagine that there definitely are people who did their masters and they got into dental school after. I know in medicine it's pretty common to do your master's